So my story started 3.5 years ago when I was a first-year resident in neurosurgery. I was working in the Emergency University Hospital here in Bucharest. And at that time, they only had, in the operating rooms, they only had gloves made of latex with chemical accelerators. So I was using that, of course, and for a couple of weeks, everything was fine. And then I slowly started to have itchy skin. And then there were the small red bumps that appeared on the surface of my skin that slowly turned into vesicles with liquid inside them. So actually, there were a lot of scrub nurses and some colleagues, doctors, that had the same problem, and they just found the easiest solution then to wrap sterile gauze around their fingers and then put the latex glove or some silk or cotton glove, which I did. I tried that for a couple of weeks as well. But for a neurosurgeon to have the thick cotton glove underneath your actual glove, you could not do surgery in that way. You lose any fine motor skill, you lose the precision, any details that you have to have during the most complex surgeries, you lose all of that, so you cannot actually work like that, operate like that. So I started researching, and actually there are a lot of articles from the 1990s that show that every chemical accelerator in a glove will and maybe will potentially lead to skin condition, which is called dermatitis, allergic contact dermatitis. And so that was the point when I decided I have to see a dermatologist. He actually did some patch tests on me and discovered that I was in fact not allergic to latex as I thought I was. I was in fact very sensitive and allergic to a chemical accelerator that is used in the gloves that they have in this hospital, which is called Theorem Mix. That is extremely toxic for the skin, it's extremely irritative for the skin. So I started researching what options do we have in Romania to help us, because the collective answer was for us just do what you do or change your job. So that was not an option, obviously. So we started in this hospital to have some PI gloves, and it had another chemical accelerator. As a specific, it had dithiocarbamat. So we actually, all of us that had problems, we used those gloves for a bit, for a couple of months. And it was fine at first. Again, after a couple of, let's say, weeks, 2-3 months maybe, the same problems happened again. And there's little information on this in Romania, so I had to do another research. I thought I was the problem, that there was something I was doing wrong. The dermatologist told me that I had to use corticosteroid creams. He prescribed me a lot of corticosteroid creams. I took corticosteroids orally as well, and then he started me on immunosuppressants. So that was a whole ordeal, because I had to take time off of work. I had to take 2 months off of work for my hands to heal under the treatment. It got so bad that I could not even move my hand. It was so swollen and itchy, and with the liquid that came from the pustules, it was not okay. And even after the treatment, when I came back, the same thing happened again. And it was like a vicious circle. I could not do anything in the hospital with my hands free of gloves, because there was the risk of infection for me and for the patient as well. And if I put the gloves on, it was still maintaining the problem on my hands. And of course, at home, there's nothing that you cannot do without your hands. So actually you have to use your hands to live, to shower, to cook, to do everything. And it was a horrible experience. And I started reading more articles and trying to find the gloves without any chemical accelerator. And then I finally found the Ansell gloves. I tried 5 versions of gloves from Ansell PI-KARE. So it's great because they have different types of gloves for different types of surgeries. For me personally, in neurosurgery, we need a glove that is thin, that feels like a second skin, and that is the PI Micro that we use. It gives you a lot of precision for types of surgeries that we do on the brain. So that's a great one. The best thing about this is that I do not have to worry about the logistics of the case. You just worry about the surgery, the patient, and that's all. And you're not responsible for anything else than your job. You don't have to find the gloves that fit you. You don't have to think about your aching hands. You don't have to think about going home and not being able to do anything at home. And also the potential risk of infection. That's in this field, it's a big thing to think about.